Hey everyone, now I'm back with you as promised. Now the last time we spoke about why do we need a pap smear, and we spoke extensively on that. We also covered some of the topics that we're going to be talking about today, and that is who needs a pap smear, when is a pap smear done, and how to prepare for a pap smear. So stay with me, stick and stay, and let's get right into the video. Before we go ahead, I'm going to ask you and encourage, please make sure that you subscribe and share this with your friends and family. Also encourage them to subscribe so that they too can get up to date with all the information that I'm going to be providing for you. All right, so let's get right into the video. So, who needs a pap smear? Now, studies have shown that women 21 years to 65 years old needs a pap smear. 21 years, whether you are sexually active or not, you should get a pap smear once you reach 21 years old up to 65 years old. One of the reasons why you need it after 21 is that younger women under 21 years are more able, their body is more equipped to handle, just like I spoke in the previous video where I said that some people, their body can actually get rid of the virus, the human papilloma virus, or HPV for short. Before you reach 21 years, the cells in your body are better able to fight and get rid of that infection quite easily, and so you are not afflicted with HPV virus. After 65 years, you are at less risk for developing cancer of the cervix, and so you do not need to do this more often. So after 65 years, you really do not need to get a pap smear done again. But there is a but. If you have a history of cancer of the cervix, or you have had abnormal pap smear results, or smoking, you have HIV/AIDS, or a weakened immune system. Once you have any of those viruses, infections, conditions, you need to ensure that you still get a pap smear done or a pap test done. And it goes the same for persons under 21 years old. Once your immune system is weakened for any reason, you have HIV/AIDS, you have precancerous cells, you've had a history of HPV virus that was tested positive, you need to ensure that you get your pap smear done. Now, persons under 21 years old have had cervical cancer. It is rare. It is very rare. So even though you do not need it, I recommend that you get it done once you are sexually active. So you do not need it, but I recommend it. After 65 years old, even though you do not need it, I recommend that you get one done routinely just the same. So if you don't want to get it yearly, you can always get it 3 yearly, because new recommendations are that you should get it 3 yearly once you've had normal pap smears, or you do not have any condition that makes you more at risk for developing cervical cancer. So now we're going to jump into when do we get a pap smear. Studies have shown that cervical cancer develops between 10 and 20 years after an HPV infection. Now, with an HPV infection, your chances of getting cervical cancer is heightened. And so that is why we check for HPV when we do a cervical cancer screening, i.e. a pap smear or a pap test. Because of this, most OBGYN or most practitioners will say get your pap smears done every 3 years. But I will maintain, and I will say, and I will encourage persons to get it once yearly. Get it once yearly just to make sure that everything is okay. Your pap smear can pick up a myriad of things other than cervical cancer. And sometimes when you go in for a routine screening and you do a routine assessment, your OBGYN will not be able to detect that unless you're doing a high vaginal swab that can actually look for specific types of infections or bacteria, viruses, whichever. But a pap smear covers so many things because it is more in depth. And so I would encourage you to ensure that you get your pap smear every year. When you go to your OBGYN for your routine assessment, just cover your pap smear. If you're going to your midwife or your practitioner, your family nurse practitioner, whoever it is that takes care of you gynecologically, make sure that you get your pap smears done yearly. If you've had 2 normal pap smears, you can skip a year and do it every 2 years. If you are more comfortable with getting your pap smear done every 3 years, fine, go ahead and do so. Just try to ensure that you do your pap smears routinely to cover yourself and make sure that if there are anything developing as early as possible, you are picked up and then you can be treated and your life can be prolonged because you got tested real early. So ensure that you get this done. Speak to your practitioner wherever you are in the world and they will guide you accordingly. It is, however, a given that after you've had a baby, a pap smear is done. One of the reasons why we do pap smear is to make sure that everything is back to the pre-pregnancy state. So we check the entire vaginal canal. So we check from the introitus, which is the opening, introitus, which is the opening of the vagina. And we go all the way, we look for tears, we look for bruises, we look for any damages, make sure that everything was fixed properly after delivery. We look at the cervix to ensure that it's healthy, it is competent and able to maintain another pregnancy because there is no lacerations there that can cause problems for you in the future. And we do a pap smear right then because we want to check for any precancerous cells. When you're pregnant, we have things in our body known as growth hormones that is helping with the growth of the baby. Because of these growth hormones, you can have proliferation of pre-existing conditions. These pre-existing conditions like precancerous cells, cervical cancer can proliferate. It can grow and get worse because of the pregnancy. So we ensure that we do that right after your delivery at around 6 weeks post-delivery to ensure that we check for these cells. If they are present, we refer you for treatment as needed. A lot of doctors do your pap smear before, during your pregnancy. And if you are getting a pap smear done during your pregnancy, it's perfectly fine. It's not gonna cause any miscarriage or anything like that because of how the pap smear is done. Once you are trained, you'll be able to get the pap smear done, and that should be fine for you. A lot of women have had a pap smear and not even know that they're pregnant until maybe a month or so later, that, after they've got their pap smear done. So you can go ahead and get your pap smear if you are pregnant. After you've delivered, please ensure that you get another pap smear done. Do not be afraid. Do not be deterred by things that people say, because there's a lot of myths that surround pap smears that have prevented a lot of women from getting their pap smear and have caused a lot of deaths that are associated with cervical cancer because this woman or that woman did not ensure that they got their routine pap smears done. A pap smear can save your life. get it done. If not for you, for their kids and the people who depend on you and want to see you around for a long time. Get your pap smears done. Last, but definitely not the least, is how to prepare for a pap smear. What you do leading up to your pap smear appointment can negatively affect the outcome of your pap smear result. I say negatively because you may have to repeat that pap smear because the test was unsatisfactory for evaluation or could not be assessed properly. So one of the things that a lot of women do not know is that before you go in for your pap smear, please avoid sexual intercourse. You avoid sexual intercourse because sexual intercourse can interfere with the cells of the cervix, and so you may have inflammation on the cervix, and that is due to the sexual intercourse. Now, inflammation comes about because of the penetration of the cervix. Now, the cervix is being penetrated. Your cervix must not have any interference. Even when your pap smear is being done, we cannot be rubbing and brushing and doing anything because your cervix is very delicate. It can damage the cells that are there, and so your pap smear becomes unreadable. Also, sperm, if left in the vagina, can also obscure the sample, and so it is unreadable, and you end up having to do a pap smear all over again, or being told that you have severe inflammation, or plain and simple, they might just say that was found. And for some people that can be a little bit embarrassing. So to avoid that, ensure that you avoid intercourse before you do your pap smear. The next thing is, please do not wash inside of the vagina. Naturally, a woman should not wash inside of their vagina because the vagina cleans itself. Yes, your vagina actually cleans itself. That is one of the reasons why you have discharge every day, because the vagina is actively getting rid of anything that it does not want. So it comes out like a discharge. If you have debris in your eyes, if you go to sleep with it, you're going to wake up with what we call mucus coming out of the eyes with the debris that was not supposed to be in there. So it's the same thing with your vagina. Your vagina will get rid of all of that. So you do not need to wash inside of your vagina before you do a pap smear or for any reason whatsoever. If you do wash inside of the vagina, you'll wash away everything that we're going up there to test for. And that's the cervix. Sometimes we have to go inside of the cervix to get to the zone that we definitely need. And I don't think you can wash there unless you're doing some evasive maneuvering. But it can obscure our results. And so therefore, avoid doing it so that we don't have to repeat a pap smear unnecessarily. I'm trying to adjust my camera, right? So do not wash your vagina before. And with washing the vagina, that means no douching. Avoid douching. In general, I do not recommend douching. Your vagina has what we call normal bacteria inside of it. Douching destroys both normal and abnormal bacteria. Your vagina needs that bacteria in order to stay healthy and to do what it needs to do, and that's to keep the vagina healthy, prevent odors, and to ensure that the passage leading up to your womb is healthy, to prevent worsening infections like pelvic inflammatory diseases or PID. So you have to ensure that you do not use these products because, of course, they're going to be causing more harm than good in the later on. And you want your vagina to smell like a vagina. You don't want your vagina to smell like roses. Your vagina should smell like a vagina. All right. So please also do not use any spermicide or any contraceptive that includes gels going up inside of the vagina. It too is going to cause your pap smear results to be obscured, your pap smear test to be obscured and cannot be tested properly. So ensure that you do not use any of these gels, any suppositories for infection. If you have an active infection, and if it's a bad infection, get it treated before you come, and ensure that you at least finish those medications 2 to 3 days before you come in for your pap smear. Ensure that you get this done before. If you have an active infection and there's a lot of infection, there's copious amount of discharge, when we go inside, we're going to have to defer the pap smear for another day, because we would have to be wiping away abnormal discharges, and then that can also interfere with the cells of the cervix, and we want to do as minimal interference with that cervix as much as possible. So would rather you get yourself treated before you come in. If you are being treated for an infection, when we go there, we may not see anything, but because you are being treated for an infection and you have a pessary inside the vagina, whether it's a gel or a pill or cream, that too can interfere with the reading of the pap smear test, and so give you a result that is not quite satisfactory, or a result that does not reflect the true reading or the true test, or what should actually be the findings from your pap smear. So ensure that you are honest with your care provider when you go in to get your pap smear done. If you are bleeding, reschedule your pap smear visit. If you are constantly bleeding or you have a bleeding issue, you can say this to your care provider. Your care provider will decide to do your pap smear just the same, because it may be recommended that a pap smear be done whether you are bleeding or not. We will make the specific notes on your sample paper, and then the cytologist will know what to do when testing that sample. If for any reason there's any STI history or frequent sexual transmitted infections, it is something that we need to know. So be honest about your sexual history when you are getting a pap smear done. It will help us to understand your result a little bit better, the findings that we have at your cervix, how to treat you, how to refer you. All of that will be very important. So ensure that when you go to your care provider, you talk to your care provider. They should be the one that you confide in to tell these things. Do not be embarrassed. Do not be ashamed. Do not be afraid to talk to your care provider, because that is what we are there for. And your honesty is going to determine the best outcome for you. So there are persons who do baths. They love doing their baths. Keep doing your baths. Sit in your bubble bath. Yeah, sip on your wine and have some fun. Take in a bath. Good for you. But before your pap smear is done, do not do a bath. Do a shower. Take showers, because you know you're sitting inside warm water, all of that. Yes, it is going up. Whether you're feeling or not, it's going up. Avoid baths. Just avoid it. Take showers before you go to your pap smear appointment. So we spoke about avoiding sexual intercourse right before. So that's 2 to 3 days. Some say 48 hours. I say 2 to 3 hours just to be safe. Avoid washing inside the vagina at all costs. You do not need to wash inside of your vagina. Avoid using spermicide as foams inside the vagina 2 to 3 days before you go in for your pap smear test. Avoid using family planning such as gels or spermicidal foams inside the vagina before you go in for your pap smear. Be honest with your care provider about your sexual history, about your whether you've had infections in the past, whether you've never had infections in the past. Ensure that you inform your care provider that you are taking antibacterial medication, antiviral medication, whether you've just finished a course or you just started a course or you're in the middle or the finishing of a course. Ensure that you inform them, because we need to know, so we either defer your pap smear or make a note if it's a pap smear that needs to be done immediately. Most of the times we will not do it. We'll allow you to finish your course, because that would be a few days either way, and get your pap smear done at a later date, which would be more beneficial for you in the long run. So 2 to 3 days after that, and some persons might want you to go longer. Some people might say 48 hours, but ensure that you are honest so that we can do the necessary work that is done to ensure that you get the best result for your pap smear. Okay, so if you have any questions, if you have any concerns, please do not be afraid to ask. Sound off in the comment. Give a thumbs up. Subscribe to our channel. Share with your friends and family. Share with your neighbors. Share with your co-workers. Encourage them to subscribe to my channel so that they too can be informed as soon as I drop a new video. I'm going to be covering a lot of topics. A lot of them is not going to have anything to do with healthcare, but it's going to do with wellness, some sort of wellness, how to make yourself better, how to make yourself feel comfortable, how you feel comfortable in the skin you are in, with the body that you are given, with the blessings that you have. Okay, so I'm going to be giving you a lot more video, and I'm going to encourage you to get as much people as you can to subscribe to my channel, because coming up I'm going to be starting a challenge, and that challenge is going to give a prize to one of my subscribers. Make sure that you do what you need to do to be that winner of that prize for the next video that I'm going to be coming up with. But before that video, I'm going to be talking about some of the myths and conceptions that comes with pap smears, right? But I'll be talking about that because a lot of women do not get their pap smears done because of these things, and it has caused so much deaths, it has caused so much misery, and it has caused so much unfairness to continue to go around. And I want all my mothers all my ladies, whether you're a mother or not, to feel safe and to be safe and to have the best thing done for you, because we are in an age in this time where medicine is revolutionizing every day, and there are more ways to live longer and to save your life, to prolong your health and your wellness. So subscribe, and I'll see you next time, and please remember to comment down below and share. Until next time, it's your girl Taylor. See you.